Thank you all for coming today. Many people don't know that an effective, safe, and natural treatment for many common ailments is right outside their window. Essential oils are a time-tested and natural method for treating and preventing many common illnesses. I learned about essential oils about 15 years ago, and I've been using them ever since. Essential oils can provide safe and easy treatment for many of these conditions. First, I want to give a brief history of essential oils. Then I'd like to list some common essential oils and their therapeutic uses, and I'll conclude with any medical concerns that you should have using essential oils. Some form of essential oils has been used in almost every ancient culture. Egyptians used it for embalming their dead. The Babylonians used it to scent mortar that they used in their temples. During the Great Plague, essential oils from herbs and flowers were used to prevent or stave off infection of the plague. As modern medicine advanced, essential oils and any other natural or folk remedy kind of fell out of favor. It wasn't until the turn of the 20th century that a pharmacist and chemist named René Gadefus was working in his lab, and he burnt his arm. And looking for relief, he just plunged his arm into the nearest vat of what he thought was water. It was actually lavender essential oil. And what he noticed was that the pain immediately subsided. And so he decided to continue to apply essential oil to his arm and see what happened to it. What happened was it healed with no scars. And so he did a lot of research on essential oil. He shared this research with a friend of his who was a medical doctor, Dr. Jean Valnet. And Dr. Valnet, years later, would treat soldiers during World War II, and he ran out of antibiotics. Having remembered this research that his friend did, he used essential oils to treat soldiers' infections during World War II. How do you apply essential oils? There are many different methods. Today we're just going to cover two, inhalation and topical application. Inhalation is very easily accomplished. You would just put a few drops of essential oil in some steaming water, just like you would steam for a cold, and you can inhale it that way. Topical application is what it sounds like. You would just apply it to your skin. A caution about that is you never apply it to your skin undiluted. You can use what's called a carrier oil. There are a lot of different kinds, but the most common one and the one you probably have in your house right now is olive oil. So we'll just assume carrier oil for the purposes of this presentation is olive oil. So the first one I'm going to go over is lavender. This one is on the top of a lot of aromatherapists' essential oil list. It is sometimes called the Swiss Army knife of essential oils, and it has antibacterial and antiviral properties. It's generally used as a de-stressor, and it's very mild and safe to use. It's one of the few that you can use on an infant or a child. So that's one of the other good properties of that oil. So the next one I'd like to talk about is rosemary. Rosemary is a mild stimulant, and it has a particular affinity for respiratory and circulatory problems. Rosemary is a good oil to use in a muscle rub because it does help circulation. It's also good to use in an inhalation if you're having some respiratory issues. The circulatory nature of it, it's also good to use if you've got a bruise or something where blood has clotted, to use that topically to try to clear that up. Next we come to tea tree. Tea tree is respected by even the most staunch conventional medical authorities. It has antiviral, antibacterial, and antifungal properties. It's probably the most studied essential oil by conventional medicine, and it originates from Australia. The Aborigines used it for thousands of years in their own conventional medicine. I like to mix tea tree with a little bit of lavender and dilute it in a carrier oil like olive oil and use it as like an all-natural neosporin. It works really well for that. Next we come to lemon. Lemon essential oil has antibacterial properties, and it also stimulates the production of white blood cells, which, as you know, fight infection. Lemon was one of the oils used during the plague to try to fight off the plague in a blend with other oils. Lemon juice also is juiced into water sometimes for detoxification, and it's also really good for that. The last oil I want to cover right now is chamomile. Chamomile is one of the gentlest essential oils. Along with lavender, it can be used on just about everybody. It has anti-inflammatory effects, and it's also really good for stomach ailments. Many of you may be familiar with chamomile tea. That's just made from dried chamomile flowers. That's really good to drink if you're having an upset stomach. And it's also good to add, along with the rosemary, in like a muscle type rub because of its anti-inflammatory effects. Some medical concerns I want to go over when using essential oils is there are some oils you want to avoid always. Oils like pennyroyal and wormwood are toxic and they're just not worth using. You want to avoid those. You should also be very careful with pregnant people. So you want to make sure that they're safe to use during pregnancy. Some will cause photosensitivity. If you have high blood pressure, you want to avoid oils like rosemary. That can exacerbate that. And as always, you always want to apply diluted to your skin. Essential oils are just an easy and inexpensive way to start incorporating more holistic care into your lifestyle. They have a lot of therapeutic benefits, and they can usually be used in conjunction with conventional medicines. But like with anything you're using, you should always ask your doctor if you have questions or let him or her know that you're using them. I hope you begin to incorporate some of these oils into your life and can see the benefits for yourself of these oils firsthand. Thank you.